The New York State Legislature passed an emergency sick leave provision because of COVID 19. However, when the New York State budget was passed 3 weeks later, that emergency provision became permanent law. With me now to talk about sick leave are Blue Carricker from Citizen Action of New York and Rosanna Korobatris from the Northeast New York Coalition of Occupational Safety and Health, also known as NENICOSH. Blue, I want to begin by asking you, why is it so important for public health that workers have access to protected sick leave?
Well, I'm sorry it's taken a pandemic to point this out, but clearly it's always better if a person can stay home when they are sick. Unfortunately, we've had a historic and cultural assumption that people should work no matter what, and that policy is literally now killing us on many aspects. It's good for the employee, good for the employer, good for the community at large, good for our society.
Your experience advocating for sick leave, is there any confusion about what the sick in sick leave means and how it will be used?
It's up to the employee to determine if they are sick. You know when you're sick and shouldn't come to work, or you know when your child is sick and shouldn't come to work. And there, of course, are always pushback and say, well, won't people abuse this? And won't people, go do something else when they are saying they're going to stay home sick? But the fact that people only have 5 days a year means that most people save those. They know what the flu is like, they know what strep throat is like, even before we had a pandemic. They know that they may need that time.
And being able to take that time away is very important for public health. But Rosanna, even though they know when they are sick, some workers just can't stay home.
So at NannyCash, we really work with what we consider the most vulnerable workers. So people that are employed in part-time positions, maybe temporary settings. They're often low-wage workers, minority workers. And so for a lot of these workers, it's really hard, to hear the recommendation, if you're sick, stay home, because they're not really able to do that. Many of them right now are considered essential workers. So, there's a higher demand for them in the workforce. A lot of these workers also do not have access to, typically did not have access to paid sick time or paid time off. And they're vulnerable for many different reasons, right? So they are trying to make ends meet. They probably have more than one job. They may be the only one supporting the family members.
In Blue, these essential workers face an even greater challenge in the way that their employment is defined. Does that affect their access to sick leave?
Yeah, it's very challenging. And there has been an increase, steady increase in the number of companies that want to label their people who work for them as independent contractors, because then they don't have to abide by a lot of the rights laws or benefits that have been prescribed by law to
So,
employees.
Rosanna, there's something more important at stake here than how workers are designated, isn't there?
Just as we've seen with the recent federal and New York state legislation around paid sick time, we know that an injury to one is an injury to all, right? So when one worker gets sick, especially around this time, those around that worker will probably get sick if there are no protections in place to ensure that the workplace is safe.
Blue, what effect do you think the coronavirus will have on the conversation about sick leave and public health going forward?
I think the clear and obvious lesson of a pandemic is people must have paid sick leave. They must be able to stay home when they're sick, and they must be able to stay home and care for their family members when they're sick. So the question is, how do we then help businesses who maybe see that as a challenging thing? And that's a role of government. Government's role is to help us all be safe and healthy, and to intervene on behalf of individuals or businesses to make that possible. And this is clearly a public health imperative.
Rosanna, how will you and your organization make the argument for sick leave going forward?
So we see paid sick time and other benefits as essential public health measures that will help to, improve the safety of our workforce. And it also makes sense because at this time when we're talking about pandemic, this is the only type of public health measure that we have that we can control for. Without having a vaccine, this is the one way that we can prevent people from getting sick. When people are able to stay home from work and their job is protected and they're able to still provide for their families because they're getting paid for that time off, then that would just help everyone.
Which can only ensure strong public health, especially as the coronavirus makes the need for strong public health more apparent than ever. Rosanna and Blue, I want to thank you both so much for sharing your thoughts and experiences on sick leave with me today.
Thank you so much, Ryan.
Great. Thank you very much.